No questions, thank you.
So, what topic have you prepared?
Today it's antipsychotic drugs.
Antipsychotics. Not, it's not interesting topic at all. So, I agree, it's not very
Do
interesting
you hear
topic.
me?
Sorry.
The names of the drugs, you mean?
Mm, including the names of the drugs.
The antipsychotic drugs, they are used to treat schizophrenia and other psychotic issues. Um,
And what other psychotic
that's
issues?
all.
I suppose only schizophrenia.
Other
Am I right? No?
schizophrenia.
Only? No?
Do you mean that antipsychotic drugs are only used for schizophrenia only?
Yes, they do.
I know.
So,
They are effective in other cases, maybe.
no, they are not effective in other cases. And
Hmm.
moreover, they can uh, they can precipitate a Parkinson disease. So it's a drug-induced Parkinson disease. At least the symptoms are the same. And they also, when used in high doses and for a long time, they can also produce irreversible, sorry, they also produce irreversible ataxia and the restlessness.
And what?
Restlessness.
Hmm.
Uh, and then also posture abnormalities and some tics can be also seen in the patients that are treated for several years.
Hmm.
This is the reason why the antipsychotics are only used in patients with schizophrenia, because they are the only effective drugs for this disease.
I see.
However, some physicians will prescribe antipsychotics for depression and
This is for severe cases of depression, right?
right, for the severe cases with suicidal thoughts. So for the bipolar depression. But me generally, I don't recommend prescribing antipsychotics for depression unless it's in the hospital condition. So only for those patients that are uh, uh, under the control of the uh, nurses. So for the community patients, I don't recommend.
I see.
So what do you know about the schizophrenia? Hulud. What do you know about schizophrenia?
Hello?
Khulud?
No, it's me.
Sandy.
I'm sorry. What were you saying?
What do
Were
you
you
know?
saying something?
What do you know about schizophrenia?
That it's I don't know how to explain it. A case where someone says something or does something and forgets they did it, and maybe they would want to do something like bipolar disorder.
No, it's not the polar disorder, and it's not
Oh
the
yes,
amnesia.
yes. I remembered. I remembered. It's seeing things which are not true, or people which are not true.
Sometimes, yes, they have hallucinations. So the patients with schizophrenia may have a visual or the uh, hearing hallucinations, and they can summon uh,
Maybe you know
hosts.
this mathematician John Nash.
Yes, I know him.
Yes. There was a movie about him, about his life called A Beautiful Mind.
Yes, that I saw that movie too.
So that's how I remembered.
He also has a beautiful wife
Yes.
and very caring. So, the patients can uh, imagine the whole worlds and also summon uh, uh, people. So, and they can speak to someone that is not exist. So, and other strange things can happen to them. So, and normally when you see any strange behavior, and then you ask person if he has his mind on. So this is the reason why when we see something strange, we can uh, assume that the person is has a psychotic disease, so like schizophrenia.
Psychotic disease, only schizophrenia.
Not only, but it is one of the main diseases. There are also like manias, bipolar disorders, and depression actually is also psychotic disease. So, uh, but the most dangerous and most hard to treat is the schizophrenia, because schizophrenic patients are uh, very uh, and schizophrenia is hard to treat because schizophrenic patients are uh, very smart, because disease will not decrease the uh, thinking abilities like in Parkinson disease or Alzheimer disease. So the memory is good and the thinking abilities are not distorted.
Is it The thinking abilities are bad in depression and other psychotic drugs, diseases.
Again, what thinking abilities
The
are what?
thinking are bad in other psychotic diseases.
Yes, there are other psychotic diseases uh, about the like bipolar disorder, depression, mania, uh, the obsessive compulsive disorders, social phobias, or any other phobias like aquaphobia, the bacteriophobia, so virusophobia, like the recent new one. So and many other phobias like the animal phobia or the insect phobia. So all of them are the psychotic diseases. However, the schizophrenia is the most comprehensive and it's untreatable one. And for many years, there were no any effective medicine against the schizophrenia until the late 60s when uh, the anapaline was invented. So, the generic name is chlorpromazine. So it is the first antipsychotic drug that started the psychopharmacology. So, because due to that, there were no effective medicines for schizophrenia, and the only effective treatment was the uh, lobotomy. So that is not very uh, that that is not very safe operation and damages the brain non-reversibly. So before the uh, availability of the chlorpromazine, and the only treatment was the living in the hospital conditions in psychiatric hospital. So that is why the psychopharmacology is a very important step in the development of the pharmacology and psychiatry, to my mind. So, uh, what do you know about the antipsychotic drugs?
Their names.
The names, mechanism of action. It looks like we have a one-to-one uh, lesson every week now.
I see.
But at least when you graduate, you will have like a you can uh, you, then tell that you graduated from the private university with a personal instructor professor. So so it's very expensive education actually.
Yeah, I know. Thanks for your efforts.
So and
Um, excuse me.
that's fine. So the what drugs do you remember from the textbook?
Um, risperidone.
Risperidone is actually atypical. So do you remember that they divided to the uh, low
First
potency?
generation and second generation.
Yes, first and second, or low potency, that is first generation, and high potency, that is the second generation, and the third group is atypical. So there are three groups.
Mm-hmm.
So the first group or first generation is the chlorpromazine. Uh, what other drugs are there? Two.
Thyroidazine,
Thyroidazine, okay.
and these two are low potency.
Only two?
I think. I think yes.
Okay, then and high potency,
High potency. Flufenazine.
flufenazine, right?
Uh, Pimozide.
Pimozide, okay, but pimozide is not used frequently. The most
Mm-hmm.
frequently used is haloperidol.
Mm-hmm.
Do you have that
Yes.
one? Haloperidol?
Yes. Yes.
Any other drugs?
Aripiprazole.
Aripiprazole, yes, it's also high potency. It's the new one, aripiprazole.
And maybe loxapine.
Which
Loxapine.
looks upon I don't remember this one, but should be new too. But mostly the haloperidol and flufenazine are most commonly used drugs. And then haloperidol also has a long-acting formulation that is haloperidol decanoate, and the flufenazine also has a long-acting uh, formulation that is flufenazine microspheres. So this is a modified release preparations.
Mm.
So most of the drugs uh, are given orally. For the haloperidol and flufenazine, the injectables are also available. For those patients who has low compliance. Okay, what else? What is the mechanism of action
Mm. Of which one?
of all of them? They have all the same, except the atypical. They have additional one, but they have a common mechanism of action.
I don't remember. It was something related to dopamine, but I don't remember what was it exactly.
It's they are all antagonists of the dopaminergic receptors,
Mm-hmm.
especially D2 receptors. So the higher is the potency for D2 antagonists, so the higher is the antipsychotic potency of the drug. And they also are antagonists for the adrenergic, cholinergic, the uh, antihistaminic, uh, and that is also all these receptors are uh, blocked in the central nervous system. So these drugs are mostly central blockers.
And in the atypical,
And atypical, they have additionally the serotonin.
Sir, yes. Mm-hmm.
Also, they block also serotonin additionally to all that
Mm-hmm.
previous one. That is why they are a little bit different, and they are used only if the uh, second generation is not effective, and first generation is not used anymore. It has been
Mm-hmm.
used for a long time, but due to less efficacy and more severe side effects from the cholinergic system, they don't used they are not used in a modern world, uh, unless the anticholinergic effect is desired or the antihistaminic effect is desired, because fluoropramazine, for example, has a sedative and mm, somnifrent effect because of the antihistaminic and anticholinergic components are very prominent. So the adverse effects include the uh, long-term treatment effects that are irreversible, and
It's
uh,
it's a chronic disease, right?
disease is chronic. All right,
Mm.
it's non-curable disease. Schizophrenia cannot be completely treated. So, and patients are always so treated by holding them in the remission. So they have a like normally they don't have a uh, exacerbation of the disease, but when they have, they require prompt treatment. So, and to decrease the treatment is directed uh, to decrease the frequency of these exacerbations, and uh, unfortunately there are some side effects that are very undesirable and non-reversible, and they include akathisia and uh, posture or uh, the posture abnormalities. So, do you know what is akathisia?
No.
Akathisia is the non-voluntary movement of the extremities, legs or hands, and
Like shaken, for example.
yes, shaking or just moving, uh, but it's uncontrollable, and then can prevent the normal movement or staying still or sitting still.
Mm-hmm.
And also the posture abnormalities will make the posture asymmetric, and the walking may be a little bit different. So these are the non-reversible adverse effects, and reversible adverse effects include the anticholinergic, the constipation, the urinary retention, then the antihistaminic, the sleepiness.
Weight gain?
Usually no weight gain.
There is no weight gain?
Usually no.
Hmm.
The weight is not increased or decreased, and the main effect of the antipsychotic drugs is uh, removing uh, the positive symptomatics of the schizophrenia. And positive symptomatics is the hallucinations, delirium. uh, so this is a positive symptomatic, and there is also a negative symptomatics that cannot be cured with any drug. And negative symptomatics is the inability to communicate, and then there may be uh, have you ever seen a patient with schizophrenia, like in the movies?
Only in movies, but not in real life.
Oh, so what they do in the movies?
Well, they talk and they imagine people which do not exist, hallucinations, and
This is a
um,
positive symptomatics.
yes. But I don't remember what else was in the movie.
They also um, make a scene from nothing, like if uh,
Oh, yes.
so like when something is goes wrong, like if you drop ice cream to the floor, that will be the end of the world for them.
Hmm.
So so you better have and give them a new ice cream right away, or they will shout, they will uh, be very angry to everyone. They can kill someone also easily. So that is why, depending on the uh, character, they may be very dangerous to the society or like less dangerous. Females are
Hmm.
usually less dangerous. So uh,
What is usually less dangerous?
females, female patients are usually
Oh.
less dangerous. So because they will not kill or
Hmm.
uh, shoot to someone, but male patients can be very aggressive, and they can fight and kill someone or injure someone. But they will think that they are fighting uh, the monster or something. Like they imagine something dangerous. So that is why they cannot be brought to the court, to the justice. So that is why they remain in the uh, psychiatric uh, hospitals for the rest of their lives, still under arrest. So if they kill people or make any other injuries. Like, have you seen the Hannibal Lecter movie?
I don't remember this movie.
Hannibal,
What was its name again?
Ha-
Ah,
Hannibal.
Hannibal Lecter.
Sorry.
Hannibal Lecter.
Yeah, right.
Ah, yes. The
So
I think the Silence of the Lambs.
yes, yes, that's right. So this is a classical.
Yes, I have.
Schizophrenic.
Yes, I love it.
So you know that who is the schizophrenic now?
Okay, I didn't know that they could be so dangerous because, like when I watched A Beautiful Mind, it was just that they showed some hallucinations, but I didn't think that they would go as far as killing someone.
That depends on their mind. So because some minds are uh, like they still are very comprehensive. Both like Hannibal Lecter is also very uh, uh, so very beautiful minded. So very very clever. But this approach is different. Like one is clever with the mathematics and with the numbers that are not harmful. So, and another one is clever with the uh, art of the killing. So depends uh, on the personality, but both are very clever actually. So even more than normal people.
So the mental abilities for schizophrenic patients are higher than normal people.
The thinking abilities are much higher. Mental abilities, like I think, uh, they're not normal, but the thinking abilities, like the memory, the intuition, the IQ is much, much, much higher.
I see.
So they have a mind that is not standard type. So maybe in other world, they will. So they are not considered the ill people, like they are not considered the patients, and vice versa. Like there may be another world that with the schizophrenic patients that are normal, and then all other patients are non-normal. So just because there is a minority of these patients, that doesn't mean that they are ill, but still most of the patients are ill and require treatment because they are not as clever as the Hannibal Lecter.
Hmm.
And that, I think, that also depends on the background. Like educated people, they can also be schizophrenic, but if they are educated well, then schizophrenia can be different. And they sometimes realize they have schizophrenia, like if they have a degree on in medicine. So and they can treat themselves also, and not
But can they diagnose themselves?
too. They can diagnose themselves too if they have a psychiatry degree, like
Hmm.
like Hannibal Lecter.
But for example, how John Nash case, for example, how would he know that these people are not real, that he invented in his mind?
They ask their family members. or make recordings usually.
Mm-hmm.
Like in modern society, you can easily record, uh, and it's easy to understand. In medieval centuries, there were no photo making. Even they cannot take picture, so it was harder to understand that you have hallucinations unless you ask someone that is around you. Okay, so the uh, the treatment is lifetime, and also antipsychotics sometimes used for treating tics.
For treating what?
Tics, like
Uh,
movements of the eye or the involuntary movements that are not dangerous but can be embarrassing. Sometimes eyes movement or the lips movement and head movements too, that are called
mm-hmm.
tics.
TICKS.
Yes, right, tics.
Oh, okay.
So tics are very common in children also. I think in teenagers are very common, but they usually pass by themselves.
Mm-hmm.
So I think that is all for today, Sandy.
Yeah, it's a short chapter anyway, I think.
It's short chapter because it's not very common disease,
Mm-hmm.
and there is no much drugs, so only one group.
Yeah, it's mentioned in the book that it's only 1% of the population have it.
Actually, it's less than 1%, I think, because they all
Okay,
live.
that's good.
Sorry.
That's good.
Yes, it is, and they usually live in the hospital, so you don't
Mm-hmm.
see them unless you are a physician. Usually, you never see them, or if you are not a family member. So there are two options: the government hospital and private hospitals.
Mm.
So
Uh, I'm sorry, I have just one question. Is it inherited?
it's not known exactly, but the inheritance is not proven. So it's hard uh, to prove the inheritance. It may be inherited, but not uh, uh, as strong as the diabetes.
Mm-hmm.
So, but most scientists believe that it is not inherited completely. But still, we have a children with uh, schizophrenia. So it's not completely understood how it's developed. So there is no much uh, research on this point because research is prohibited by the law. So one cannot perform research on psychiatric patients because of the ethic
Even
circumstances.
yeah.
So, but it's believed completely random. No Not inherited, at least directly, no.
Okay.
So
Thank you.
if you fall in love to the psych patient with this schizophrenia, then you can have a healthy children. So no problem.
I will keep that in mind in case I do.
Uh, so good luck to you in carrying that patient. So you will at
Thank
least
you.
you have a medical education, then you will become a adult sitter.
We have only 3 classes left.
Uh, yes, I think not so much. One
Okay.
moment, I will check.